Medicaid cuts still a hot topic on Capitol Hill. Just 2 weeks after voting to pass the One Big Beautiful Bill Act, chock full of cuts and additional eligibility requirements, Senator Josh Hawley is looking to prevent any future reductions.
Well, under the bill that we just voted on and passed 2 weeks ago, I was able to secure $1 billion in new funding for rural hospitals in the state of Missouri. My new legislation would double that funding. So even more money for rural hospitals, number one. Number two, my new legislation will make sure there's never any cuts in the future to hospital funding in our state. I just think it's so vital we protect our rural hospitals and that we protect folks who need access to health care in rural parts all over the state.
Hawley maintains that he does not support Medicaid cuts of any kind, but with the Congressional Budget Office estimating that Trump's mega bill could leave nearly 12 million Americans uninsured, that's created some confusion. The senator has previously told me there were no Medicaid cuts in the reconciliation package. I asked him what the difference is between what he approved and what he's trying to prevent with his legislation.
I support the work requirements. I thought that was one of the really good things in the bill. It means that if you're on Medicaid and you're able-bodied and you're not working, you should be. That, I think, is absolutely necessary. That's an anti-fraud provision. I also support kicking illegals off Medicaid. The Congressional Budget Office estimates there's 1.5 million illegals on Medicaid right now. That's taking away money that ought to be going to hardworking Missourians. But what we also want to see happen is we want to see Medicaid benefits protected, and they are 100%, because I will never vote for a benefit cut. And number two, we want to see rural hospitals fully funded. I want to make sure that rural hospitals never get their funding cut, not just now, but at any time in the future.
Under the Big Beautiful Bill, the amount of shared revenues states can bring in from Medicaid will be limited, with extra provisions placed on provider taxes and restrictions to state-directed payments to medical facilities and providers.